Okay, ladies, this is by no means a super professional training video, but it is just going to go over how to use MCG and Borger. So if you go down here, enter a keyword and search. We're going to do pneumonia. We're also going to look at some other ones. It's very hard to do while I'm looking at the iPad screen. So it'll pop up and look like this. Now it's different than the one we used for Freestone or the one we used to use for LaSalle because it's showing you codes. But if you look over here, you can see this is pneumonia observation care. This is pneumonia. There's pneumonia pediatric. Anything that, this is a different code but the same thing, pneumonia, pneumonia neonatal, etc., etc. So let's go up here and click on pneumonia. You'll click on the guideline code. And once you're in the guideline code, if you look right here, it says clinical indications for admission to inpatient care. And this will look just like it used to, except this particular program doesn't have those cute click boxes that turn green. Most of the hospitals that use this program print these out and attach them to the patient chart. So for admission is indicated for one or more of the following. So you would need one of these dots here on the side. It still has the calculators available for you. It just doesn't have the green light and the check boxes. So there's hypoxemia. You can click on it and it will define what that means. And their definition of hypoxemia is an O2 sat less than 90% or arterial blood gas less than 60 on room air. A patient without a baseline for supplemental oxygen who now requires supplemental oxygen and to keep it greater than 90 or a PO2 greater than 60. So it gives you the definition. So anytime something can be lit up blue like this, if you hover over it, if you click on it, it will either give you the guidelines for what meets for that. For instance, tachycardia within hemodynamic stability also lights up and it tells you what they deem as tachycardia. And that's for an adult or anybody over the age of 6 years old, it's 100 beats per minute. So if you're doing a PD patient, it's different, but for an adult, it's heart rate greater than 100 beats per minute. So you can say, okay, they have tachycardia. You can go on here. It says that persists despite appropriate treatment. So it would be somebody who'd been in the ER and had multiple vital signs taken. And then you could go over here and say, okay, well, they have hemodynamic stability. This only required one. They meet inpatient. Altered mental status, dehydration, bacteremia, moderate risk or high risk patient. And this will tell you what that means. The PSI 4 or 5 or curb 65 greater than 3. That is the same. The curb 65 is the same scale that we use in interqual. It's just not called curb 65. So if you go over here to these calculators and you click them, the little calculator will pop up. You can scroll down. You can enter all the information. So you can type in the patient's age. Let's say they're 78, it's a female. Scroll down and see if they meet any of the other boxes. Do they have renal disease? Do they have altered mental status? Is their heart rate greater than 124? Whatever it is, you can click it. Is their BUN greater than 29? Let's just say it is. And maybe they had glucose of 300. So you can say calculate, and it'll say that they're class 4, which means for this particular criteria, they'd have to be 4 or 5. So you could say they do meet inpatient. For the curb 65 calculator, if you click this one, it's the same criteria that we use in interqual. Altered mental status, BUN greater than 19, respiratory rate greater than 29. This one has SBP less than 90. We don't do BP in interqual. And then age greater than 65. So they do it based on points. In interqual, OBS is 1, inpatient is 2. So we could say, let's just say they had all 3 of those. Calculate, it says you have to have a score of 3. And to be admitted, they'd have to have a score of 3 or greater. So it's a little bit different in this one, whereas it'd be inpatient with just 2 of those for interqual. But that's how you kind of navigate the chart. I'm going to go over general with you guys because that seems to be where most of the things you're going to find are. So general observation care right here. Go here and go observation care admission criteria. And if you will see, it says is appropriate for patients with all of the following. So you're going to have both of these. So if you click the plus sign for this one, it says they have to have all of these. So this, and this. Now on like Freestone's MCG, they had check boxes that would turn green, but it's going to be beyond scope of usual outpatient care episode, which anybody, you could say that about anybody in the ER. Expected to be short term, you could say that about anybody too. Appropriate observation care is indicated by one or more of the following. Either they need more testing, they need more treatment, or they need to be monitored. So that can be pretty much across the board. A patient who is dehydrated, you could say you needed to monitor them for rehydration. A patient who came in with chest pain, they needed to be more diagnostic care. A patient who had abdominal pain and vomiting that just wasn't quite feeling better, you would want to give them more treatment and watch them in response to that treatment. So you could say this about anyone, and you just have to have one of these. So you would have to have this one checked, and then one of these guys. And then the second plus sign is where all of the body systems are. So, sorry, I can't see and do this at the same time. So this is, they would have to have one of these conditions as well, which this, you can find anything in here that relates to a person's stay. So either a significant reaction to treatment, monitoring after treatment, and it gives you a kind of examples. This isn't the only things it meets for, but it gives you examples of what that would be for, like response to COPD, abnormal findings from either a lab test, imaging study, or physical examination, prompting concern that follows that needs follow-up assessment. So if they had some labs that were out of whack, or they had something like some cellulitis, etc., and you couldn't make them meet under cellulitis, you can make them meet under OBS here. Cardiovascular abnormalities, respiratory abnormalities. This is where hypertensive urgency is, by the way. There is an inpatient hypertension, but if you can't make them meet that criteria, this falls under general observation. Respiratory abnormalities, infectious process, neurological abnormalities, altered mental status is under here, gastro problems, suspected pancreatitis, ileus obstruction, possible appendicitis observed in response to hydration. So anybody who comes in who's getting fluids because they think they need hydration, that would fall under that. Obstetric issues, head and neck issues, electrolyte or mineral metabolic derangements. So all of your electrolyte imbalances are going to be in general observation right here. Injuries such as snakebite or trauma, a motor vehicle accident, etc. Control of significant vomiting, temperature abnormalities, poisoning, severe pain, behavior health issues. There's also a general pediatric one underneath here, and then it gives a list of examples of things you might need to monitor them for: repeat vital signs, cardiac or respiratory issues, IV infusions for medication or electrolytes, respiratory therapy, a rapid diagnostic testing, and then a child whose situation is one or more of the following: either a clinical response to outpatient therapy is uncertain, or outpatient supervision by parents or caregivers is uncertain. So if this patient comes in, they're a teenager and they're a runaway, something's going on that makes that you're not certain that they're being taken care of, or if they've come back to the ER 3 times in the last 2 days, they would meet under OBS. There's a lot more pediatric information, but this is where you can find most of your observation criteria. Always look up the inpatient guideline first for whatever diagnosis that is, but if you cannot find the diagnosis, then you can usually find it under general observation care, but that's pretty much it. And I have all of this, every bit of this, in the template for general observation care inside of CMI Notes. But when you're doing that, you need to make sure you remove all the stuff that doesn't apply and just leave the one that does. So if it's just, you just need cardiovascular abnormalities, make sure you delete all the other stuff in that template to where it only shows that they met cardiovascular abnormalities, because otherwise they're going to wonder why all the rest of that criteria is on there. If y'all have questions about this video, let me know. I'm going to make some other ones about certain inpatient criteria. I hope this helped y'all a little bit. Sorry for how poor of quality this is. I am not good at making videos.